Surgical technology. Oh, that's good. T. Oh, yeah. E. C. H. O. Oh, sorry. H. And sorry. N. O. L. O. G. Y. Good. Technology. So, surgical. Okay. So, do you know anything about surgical technology? I'm just gonna ask you yes or no.
Yes.
Yes. Okay.
Do you wanna give a sentence?
It's up? Yeah. Do you wanna?
What do you know?
What do you know about surgical technology? S. Good. Yeah. Good. Good. Not okay. Alright, we'll go back to that, okay? So, okay. So let me just give you a brief thing about surgical technology. So surgical technologist, also known as a scrub tech, surgical technician, or operating room technician. So it's an allied health professional working as part of the surgical team. So that's what I do. I'm part of the surgical team. We try to get surgery done as efficient as possible with the doctor. So, okay. Alright, we did that already. So surgical technologists are a member of the surgical team. The members of the team include the surgeon, the surgeon's assistant, the circulating nurse, and the anesthesia provider. So who's part of the surgical team? Is it a surgeon or a patient?
Patient?
Or is it surgeon or patient?
Patient?
S-U-R-G-E-O-N. Surgeon. Okay. So the surgeon is part of the surgical team. So the surgeon is the one doing the actual operation. I'm just there to basically help him and give him what he needs. So as a surgical tech, we have to have the knowledge and skills. Yeah, the knowledge and skills to stay sterile. Yes, ma'am. To stay sterile and use aseptic techniques. So that means that we have to gown ourselves properly. So we have to make sure that we're not contaminating anything. So that's a big part of our job, is to keep the sterile field sterile. So no germs get inside the patient. Okay? So another one of our goals is to anticipate the next move for the surgeon. So we have to think what the surgeon's going to need next. So that we have to do that to make sure the procedure goes as smooth as possible. Okay. So what do I need to do? What does the surgical tech need to do in order to make the procedure move as efficient as possible? Do we need to anticipate or drop instruments? So anticipate or drop?
Yes.
Good. Good. You're almost there. I'm copying it. T. Good. I. C. I. Good. Almost there. P. A. T. E. Anticipate. That's a big part of my job, is to anticipate the surgeon's next move. Anticipate. Okay. So the types of surgery that me specifically that I work on are normally orthopedic, neurology, general, and robotic surgery. So would you like me to elaborate on the? Would you like me to elaborate on the types of surgery that I do? Okay, good. Okay, so one of the most common surgeries, which is a general procedure, is it's called laparoscopic cholecystectomy, which is the removal of the gallbladder.
Bladder?
The reason why they do that is because it gets infected and it can necrose. So
Yes,
they need to take it out of the patient. So that happens a lot.
Bladder,
A lot of people's gallbladders get messed up. The other one is the appendix.
We're gonna be done to that?
So that's called a lap appendectomy. So that's the removal of
The guys come in?
So do we know anybody that had their appendix removed?
Yes.
Who do we know that got their appendix removed?
Yes.
Someone in.
Okay.
Okay. Good. 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 R-Y-N. Right. Catherine got her appendix removed when she was, what, 13?
Yeah, maybe.
R-Y-N. And it's extremely painful. She had
It almost
extreme pain in her lower left quadrant, which is right here. It said the appendix is right here, right on top of your colon. So how that's done is, what the doctor does when they do it laparoscopically, they put ports in your abdomen. So they put usually 3 or 4 ports in your stomach, in your belly. Yeah, and they put a camera through, so then it's on a TV monitor.
That's mine.
So you can see it, actually see the appendix, or you can see the gallbladder. So then they're able to surgically remove it with instruments, with laparoscopic instruments. So that's how that procedure is done. So that's pretty cool. What do you think? What do you think about? Are you interested in this type of stuff?
Yes. Yes.
Okay, good. So what out of my specific fields? I'll write it down. So neurology, orthopedic, orthopedic, and general. Let's just say general, because robotics I'm not that familiar. So out of neurology, orthopedic, and general surgery, which one do you think would interest you the most?
General. Yes.
Find it.
And
Good.
O-E.
Almost slow.
E.
Good. E.
W.
U. R. O. L. O. G. Y. Neurology. That makes sense, right? So neurology. So they do all types of different neurological procedures. There's some really cool ones too. When for Parkinson's disease, that's when their body shakes uncontrollably. So they have a battery implant device that they put into the back of. Usually in the back, they usually do 2 little holes in the back of the skull, and they're able to pinpoint where those tremors are causing from the brain. So they put a battery device in to help aid the tremors. So that's one of the surgeries. Another one that's really common is when they have cancer. So they have a brain tumor.
Yeah.
All right, so let's spell tumor. Let's do some practice. Tumor.
And then we'll be done.
T-U-M-O-R. Tumor. Good. So that's pretty common, and it's actually not as difficult as you would think.
We're gonna be done.
So what they do is they make
Can I
an incision.
We're gonna be done.
In the skull where it's needed. They drill holes. They take off a piece of the skull.
We're gonna be done.
They get to the brain and they just remove the tumor, basically. They just remove as much of the tumor that they can get. And then afterwards, usually
Maybe draw a picture of.
Yeah, I'm not the greatest artist, but I'll try. So, let's see, that's the person, well.
Maybe Roy could try to do it.
Let's say it's in the back let's just say this is the back of the head. So what they're going to do is they're going to they do what is called burr holes. So it's with
Do you have that instrument?
No, I don't have the instrument on there. But it's basically this little burr. So they drill it into the skull. So they do 1, usually do 2, and 3. So look, and then it's basically like connecting the dots. And then they saw with a little saw this part, that part, that part. So then they remove it. They remove that piece of the skull. So this part is out, and I have to hold that and make sure it's protected. Then they go to the brain and they start removing with a forceps. So I actually have a picture. None of these instruments are the specific type of instrument that you use, but one of these is called a forceps. So it's a different type of forceps than this to remove the tumor, and they send it for pathology. So they test it and they see what kind of tumor it is, and then they usually do radiation afterwards. But I'll go through these instruments. So here, this is called the Kelly clamp. This one's called the Kelly clamp. So let's just write. I'm gonna write Kelly on here. K-E-L-L-Y. Kelly clamp. Can we spell that?
Yes.
So Kelly.
K.
E-L-L-Y. Good. And this clamp. C-L-A-M-P. Good. Kelly clamp.
Can I send the card?
Almost not. Okay. So also that's just part of my job. I'm in charge of setting up all these instruments. So when the surgeon asks me, says Kelly clamp, I have to make sure that I know where it is and I have to give it to him in a timely fashion. So that's pretty critical because if you have a bleeder, something that's bleeding, they have to occlude it with the clamp, and then they will bipolar it or they'll bovie it. So that means that's something different.
Can I send the card?
That's coagulating blood through heat, so it stops the bleeding
Can I
by
send the card?
putting heat towards it.
Can you spell coagulation?
Huh?
Let's go coagulate. C-O-A-G-U-L-A-T-E. Coagulate. So write down coagulate.
We're gonna be done. We're gonna be done today.
And what does coagulate mean again?
So coagulate means
Does Ryan know what that means?
stopping. What? All right. So what does coagulate do? It's what does it stop? It stops from what?
Car.
It stops what? L-E-E-D-I-N-G. Bleeding. Right. So it stops bleeding. So that's important. So you always need to have some type of bipolar or bovie or suction. So those are ways that you can stop bleeding by suctioning it, coagulating it, or clamping it, or occluding it with this clamp, with this Kelly clamp. Okay. All right. So do you want to know? Do you want to know what the names of these instruments are? Good. Okay. Yes. Okay. So look, this next one, it's kind of hard to see. I actually have one. I have a clamp in the basement, so I can show you. It's a needle holder. So this right here is called a needle holder. So let's fill out needle holder.
N.
Good. N. E. E. D. L. E. And holder. H. O. L. T. E. R. Good. Needle holder. So it's basically self-explanatory. You use this clamp to clamp a suture, which has a needle on it and a string. So it's used to suture, just like it's like sewing. So like you sew.
We're gonna be done today.
Like Nanny will sew a blanket or something like that.
We're gonna be done.
So the needle holders used to usually close the skin. So it puts a needle on it and it closes the skin or close whatever fascia or tissue needs to be closed. So it's sewing. That's what it's for. This is a knife, a 10 blade.
Can I send the card yet?
10 blade. So let's spell blade.
We're gonna be done.
This is just a knife. That's what they use to make open incision for the most part. So let's spell blade. E-L-A-D-E. Good. Blade. So there's different types of blade. This one right here in this picture is a 10 blade. It's usually for making big incision in the abdomen. They have 15 blade, which is a smaller blade, which they'll use for different things, or 11 blade, which is sharper, but it's more.
Can I send the card?
But it's more pointed.
Can I send the card?
It's more of a pointed blade. We're gonna skip this one because it's really not important.
We're gonna be done today.
This one is called a Mayo scissor. So let's spell out Mayo. That's the specific. It's actually, I'm sorry. That's a curved Mayo scissor. So let's spell out curve. C-U-R-V-E. B-E-T. Good. Mayo. M-A-Y. Oh, good. That's a curved Mayo scissor. Mayo curved.
We're gonna be done later.
So. So that's a curve. So with this function of the scissor, all these instruments have a different function. The surgeon knows what instrument he needs to perform which part. So say they're doing a big open abdomen incision and they need to cut through thick fibrous tissue. They're gonna ask for a Mayo scissor. So in my head, if they're doing that, I have to think, okay, he might need a curved Mayo scissor right after he makes this big incision to get down to whatever organs they need to see to perform the procedure. Alright, so these last two are called forceps. So this looks like a smooth forcep. So there's no teeth this one has little teeth. It's hard to see, but it has little teeth, and that's to grab skin. The smooth forcep you use to grab the organs, because you don't want to. If you use a forceps with teeth in the organs, you can puncture it.
Teeth?
So it needs to be soft. So these ones, this is called a basic smooth forceps.
Dentist?
So right, at the dentist they have they use these type of instruments.
We're gonna be done later.
Dentists definitely use that.
We're gonna be done later.
So smooth forceps. So let's spell that. Smooth forceps. You're doing great. We're almost done. S-M-O again. O-T-H forceps. F-O-R-C-E-P forceps. Smooth forceps. So that's used. I just explained what the function of that is. And then the last one is called an Adson forceps. It's called an Adson forceps. So it has an Adson forceps with teeth. That's what it's called. So that's used to grab skin for the most part. When they close the skin, they usually use an Adson forceps. So let's call Adson forceps. So A-D-S-O-N forceps. Good. F-O-R-C-E-P. Adson forceps. And that's the lesson, bud. That was great. Good job.